Hello, my name is Maya Petrova. I am a medical consultant of Neurosoft company. Today we are going to examine a patient's retinal function with multifocal electroretinography test. The test is done with Neuro ERG system manufactured by Neurosoft company. However, any ERG test, including multifocal ERG, can be done with any digital EMG and EP system of Neurosoft company, including Skybox and NeuroMap micro devices. So what do we need today to make a test? First of all, the ERG system itself. To prepare the patient's skin, we should have the abrasive paste and also alcohol wipes. To prepare the patient's eye, we should use mydriatic eye drops and topical anesthetic drops. Upon the procedure completion, we shall use the antibacterial drops to ensure the conjunctival prophylaxis. Also, we need the forehead and chin support assembly to let the patient relax and minimize the artifacts. The high-resolution pattern that is used as stimulator, it will be connected to the monitor. As for the electrodes, we can use two E-clip cup electrodes that are fixed on ear lobes. These are our reference and ground electrodes. Also, we need a corneal contact electrode. We can use either silver-coated, hook-shaped or loop-shaped electrode. Today we are going to use a hoop-shaped electrode. The corneal electrode is connected to the device with a special adapter. For corneal electrode cleaning, we can use two medicine glasses. One of them is filled with alcohol solution to immerse the corneal electrode, and the second one is filled with either saline solution or distilled water to rinse the electrode after immersion before its fixation to lower eyelid. To obtain a high-quality signal recorded in accordance with ISCEF recommendations, we should prepare a patient in a certain way. The patient's pupils should be fully dilated. To do this, use the mydriatic eye drops. The short-acting ones are preferable. It should be applied 10-15 minutes before the test start. Then, before the electrode placement, we should instill the topical anesthetic drops to minimize the pain occurring at corneal electrode fixation. As all other evoked potentials, including multifocal ERG, these responses are low amplitude ones. That is why it's very important to prepare the patient's skin. How can we do that? First of all, we should decrease the places to fix the reference and ground electrodes on the ear lobes. Ensure ipsilateral and contralateral electrode position respectively. To do this, we can use the alcohol wipe and then the abrasive paste. That is rubbed up to slight skin reddening. The remains of the abrasive paste can be removed. The special air clip cup electrodes are used as a reference and ground electrodes. As I already told you, the reference electrode is placed at ipsilateral ear lobe. Thus, if the test the state of the right eye retina, we use the right ear lobe. Before the electrode fixation, it is moistened with a current conducting gel and then fixed to an ear lobe. The electrode connector is plugged in the minus input on the electronic unit. The ground electrode is fixed to a contralateral lobe and plugged in the ground input colored green. Then we should fix the corneal hook-shaped electrode. To do it, ask a patient to look upward, pull off the lower eyelid and position the hook. After that, release the eyelid and fix the electrode cable with the medical tape. The electrode cable is plugged in the device via the special adapter. During the multifocal ERG test, it is required to use the chin and head support assembly. It is done to minimize the patient's head movements and tension of muscles of neck and head. That is more important, during the stimulation, the patient should look at the fixation point and avoid blinking. When the stimulation cycle is over, the patient can relax, close their eyes or blink. To obtain the reliable results, correct the vision acuity if it is not normal. According to ISTEF standard, the successive monocular stimulation is recommended. That is why, during the stimulation, the eye not being tested is covered with a black eye patch. Please position your chin on the chin and forehead support assembly. Let's continue. Open the neuromap.net program, press New Exam button. The exam dialog box is opened. Enter the patient's data. Name, sex, birth date, height, and so on. Upon the completion, press OK button. Now choose the required test template, multifocal ERG 241 hexagons, and choose the stimulation site, right eye. Here you can also adjust amplifier settings, filters, signal input range, sample range, and so on. Stimulator settings. Here you can see that 241 segments, hexagons is chosen. You can see here the frame frequency, the screen resolution, the M sequence length. By default it's 511, but you can choose another numerous, and you can choose the M sequences in one cycle. You can make it more, but it will increase the total duration of stimulation cycle. Or you can choose the measurement cycles, the cycles of stimulation number. You can make it more or less. By default it's 15. OK. Press OK button if everything is OK. Ask the patient not to blink during the stimulation and relax neck, shoulders and face muscles. Let's check the impedance. It's quite good, as we can see, and now we can start the stimulation. Please don't blink and look at the fixation point. Well, while the stimulation continues, we can discuss the obtained responses. The response is a wave with the initial negative deflection followed by a positive peak and the second negative deflection after the positive peak. These three peaks are called N1, E1 and N2 respectively. In total, this is the first level response. It is most often estimated in clinics. The markers on the average traces are set automatically, but if it is required, they can be set manually. Now you can have a rest. The first stimulation cycle is over. Then these traces will be averaged with traces obtained after other stimulation cycles. At this step, we can accept this result and continue, cancel this result, or finish the stimulation. If we accept the result and continue, it doesn't mean that it can be excluded henceforth from averaging. It can be done, then we obtain the overall traces. So we accept these results and continue stimulation. Please don't blink. Thus, we have finished all stimulation cycles and obtained the array of average traces and the topographic map of responses. We can estimate the quality of the obtained raw traces and remove the artifacts by pressing the reaveraging button. Here we can see all native traces. We can see a lot of blinking artifacts. We can remove them, and the program will exclude them from averaging and make the required adjustments. When the selection of artifacts is over, we press OK button, and the reaveraging occurs. At the topographic map, we also can see changes. Now we can review the necessary traces and adjust the automatically arranged markers if we need. If everything is OK, we go to Report menu, Comment, choose the template, and the program will generate the test report. It can be printed black and white or colored if you have the color printer. Thank you for your attention.